Hi, in this video we're going to talk about lower back stability or lumbar stability. My name's Dr. Dave from your Osteopath, and we see many people with this problem in the clinic and we actually treat them regularly. One of the things you can actually do at home is you can actually do some activation exercises that will help stabilize your lower back, and these can be a self-monitoring exercise at home that helps improve your lower back stability. First thing you have to do is how to activate your stabilizing muscles of your back. Now, your core muscles of your back, or your transverse abdominis, or TA as you'll hear about in Pilates, is a muscle that wraps all the way around your tummy and interdigitates or builds into your back, and it gives your back stability, okay? So what we need to do to activate this is we have to visualize the pubis, or the bone at the front of your pelvis, and your belly button, and then you draw your belly button in towards your spine. And when you do that, you visualize your pubic bone slowly coming up and reaching towards that belly button. Holding that, you then visualize these two bones here on the front of your pelvis, which is your ASIS. And what you do is, while you're holding that, you imagine them moving in towards this way. Now, they don't obviously move, but the trick is by activating the muscles that attach to them, it improves the stability of your lower back. Now, this stability exercise can be done all day. It can be done while you're sitting down, while you're standing up, and when you're laying down. It's often easier to try these laying down and activate these and get a bit of practice before you actually do other positions. But the idea is, if you've activated this, it gives you more stability. Now, there's a couple of exercises that once you've mastered that, you can start on the basics of getting these right at home. The first one we do, laying down, bending the knees up. And then what we do is we draw the belly button in just like we talked about towards the spine. And then you self-monitor by placing your hand just on that ASIS, but just feeling the muscles of the tummy, and you actually feel them flatten. That's how you know you've activated them. So then in this exercise, what we're going to do is just gently, in controlled manner, slide the leg one at a time out, and just feeling that. And when you actually feel that drop off and get soft, you then bring it back up. You take a big breath in, breathing out, drawing the belly button back in, and re-perform that exercise. Each time you'll get better and better, and the range will get more and more, and you do the same on both sides. The other exercise uses a rotational motion of your legs. For this one, we do exactly the same. We take a breath in, breathing out, drawing the belly button in towards the spine, and you gently rotate this leg towards the outside. Now, in doing that, you just make sure that, once again, that muscle, as soon as it gets soft, you turn it off, you come straight back to the middle, you take a breath in, breathing out, drawing that tummy in, and doing exactly the same on the other side. And all the time you're monitoring that with this hand. The important things to remember with this one is you don't rotate your whole pelvis as you do it. If you start doing that, you're going too far in this exercise. Now, these are the basic exercises that you can do, and once you've mastered these, there's more advanced ones we can do, which I'll actually show you in another video. But I hope this helps you get started with that lower back stability.